Okay, so today's webinar will likely be a shorter one. Hello and welcome everyone to our webinar Wednesday, this June 16th for Men's Health Month. June is Men's Health Month, and today we're going to be focusing on male breast cancer. Just as a reminder, for those of you who are joining us on Zoom, please mute your microphone. We are streaming this live to Facebook, and this will be recorded and uploaded to our YouTube video library. And please use the chat box if you have any questions. For those who are joining us on Facebook Live, you can use the comments feature to ask any questions throughout the presentation. The Webinar Wednesday series is brought to you by the Office of Community Engagement and Cancer Health Equity at the University of Chicago Comprehensive Cancer Center. Our office is tasked with bringing cancer-related education to our University of Chicago community and the greater community in Chicago and its collar counties. So we welcome everyone from wherever you are to this cancer education webinar. So as I mentioned, June is Men's Health Month, and I was kind of having sort of a hard time thinking about, well, what are we going to focus on for Men's Health Month? We recently did testicular cancer awareness. We did some men's health stuff back in November for our webinar for the Movember Men's Health Awareness Campaign. We did some urinary tract cancer. We did prostate cancer. We've got more prostate cancer coming up for Prostate Cancer Awareness Month in September. So I was like, man, everything felt kind of repetitive when it came to men's health and cancer. And then had sort of this light bulb moment that the one thing that we really have not focused on too much is male breast cancer. Male breast cancer is, of course, a little more rare than a lot of the other cancers. And so sometimes it doesn't get as much airtime. Even some of the research in male breast cancer is kind of behind. So I wanted to focus on male breast cancer for today. I'm going to give you some quick information about male breast cancer, and then we will have a survivor story video that we'll share. So the American Cancer Society every year looks at the data and puts out some estimates for how many people they think will get diagnosed with a new cancer every year, and what they think the estimated mortality is. So in the United States for 2021, the American Cancer Society estimates that there will be 2,650 new cases of invasive male breast cancer, and about 530 men will die from it this year. That's their estimates. And for men, the lifetime risk of getting breast cancer is about 1 in 833. Just for comparison, for women, lifetime risk of breast cancer is 1 in 8. For women, it's about 12%. So obviously the chances of a man getting breast cancer are much lower for a variety of reasons. Primarily men, while they have breast tissue, they don't have as much as women do. So it's a much rarer cancer in them, but it still does happen. It still does happen to men. It's still something that all the men in our lives, whether they're fathers, spouses, brothers, sons, cousins, friends, whoever, that men should be aware that this can happen to them and just be vigilant about checking their own bodies to see if there are any irregularities in their breasts that should warrant a further exploration by a doctor. So the types of male breast cancer are similar to the female ones, or the same types really as the female breast cancers. So these are the most common ones: invasive ductal carcinoma, meaning the cancer cell grows outside of the ducts into other parts of the breast tissue. Invasive cancer cells can also metastasize to other parts of the body. Then there is invasive lobular carcinoma. Cancer cells spread from the lobules to the breast tissue that's close by, and they can also metastasize to other parts of the body. And then there's ductal carcinoma in situ, and this is a breast disease that may lead to breast cancer. The cancer cells are only in the lining of the ducts and have not spread to other tissues in the breast. And so these are the most common types of breast cancer, both in men and women. And a lot of the information today, by the way, that I give may be a little repetitive for those of you who are already familiar with a lot of things about female breast cancer, because there is a lot of overlap here. Signs and symptoms for men: a lump or swelling in the breast, which can be painless, but not always. Any skin dimpling or puckering around the breast. Nipple retraction, meaning if the nipple is sort of turning inward, that can be a sign. Redness or scaling of the nipple or breast skin. Any discharge from the nipple. And because breast cancer can sometimes spread to the lymph nodes under the arm or around the collarbone, any lump or swelling there, even if they're not feeling anything in the actual breast itself, any pain in the lymph nodes, especially under the arm or around the collarbone, any lumps or pains there should be checked out as a possible symptom of male breast cancer. And again, this is similar to what women should look out for too. So in terms of the research for male breast cancer, there has not been, it really lags behind a lot of the other cancers, especially compared to female breast cancer. But there was a study done by some researchers at the Mayo Clinic who looked at they looked at a database of about 10,000 male breast cancer patients over time, and they identified some factors that led to better outcomes for men with breast cancer and some that led to worse outcomes. So on the left-hand side of the chart here, some of the risk factors that led to worse outcomes: older age at diagnosis. African Americans had worse outcomes than white Americans. High grade or stage tumor at or the stage of the tumor at the diagnosis. And men who had a total mastectomy. So these first three, these track with a lot of other cancer disparities that we see, right? If your tumor is at a later stage, you're gonna have a worse outcome. We know that in our healthcare system, we have a lot of racial inequities, so that was not surprising. Same thing, people who are older tend to have a lot more comorbidities, making these cancers more likely to have a worse outcome with them. The total mastectomy was sort of a weird thing to see. You would think that men who have a total mastectomy would be more likely to have better outcomes for breast cancer, but that was not what they found. And they had a couple theories for this. First, they actually found out that men in general were more likely to have a mastectomy if they had breast cancer than women were, which they attributed a lot to the fact that men have, because men have smaller breasts and less breast tissue, they felt that it was it was easier to get rid of the breasts in men. And also men didn't have a strong identity with their breasts in the way that women do. So they found that men were actually more likely to get mastectomies than women were. But they also said that men with later stage cancers were much more likely to get total mastectomies in general. And they felt that they were probably overrepresented in their study here, which is what made that a risk or a factor that led to worse outcomes. And then on the right side here, high economic status, we see this across all kinds of different cancers, right? Socioeconomics plays a huge role in cancer disparities. So that was no surprise. Men who have progesterone receptive positive breast cancer were more likely to have better outcomes. That's similar in women. And then men who got a combination of radiation, chemotherapy, and endocrine therapy had better outcomes than men who didn't have those things. And so I linked to this study. For those of you on our Zoom call, I'll be sharing this PowerPoint with you, and you can read that here. It's called Male Breast Cancer in the United States, Treatment Patterns and Prognostic Factors in the 21st Century. And that's a fairly recent study that looked at, like I said, a database of about 10,000 male breast cancer cases. So it's pretty comprehensive. So some risk factors for men, and again, these mirror a lot of risk factors that we see in women, and they mirror a lot of risk factors that we see just in other cancers. So risk of breast cancer increases with age, and for men, most breast cancers are found after the age of 50. Also true of women. Genes. So if you have a genetic mutation, especially BRCA1 and BRCA2, that can increase a man's risk of breast cancer. Also increases his risk of prostate cancer. So for BRCA1 and BRCA2 mutations, a lot of women get tested for them because women with BRCA1 and BRCA2 mutations have an increased risk of breast cancer and ovarian cancer. So if you know that you have that in your family, please encourage the men in your family to get checked out for that as well. A lot of times only the women will go to get that genetic testing because they think breast cancer It's a women's disease. Ovarian cancer, this is just something that women need to get. And so a lot of men will not follow up and get the genetic testing as well. And that is very important that they do that. As with women, a man's risk for breast cancer is higher if a close family member, especially a first-degree family member like a parent, has had breast cancer. So family history does play a role. Radiation, men who have had radiation therapy for other issues in their chest have a higher risk of getting breast cancer. Men who go through any kind of hormone therapy, basically any drugs containing estrogen, will put men at an increased risk for breast cancer. And so that also men who are transitioning, so trans women who go through hormone therapy to increase estrogen, they're going to be, through that hormone therapy, they're going to be increasing their risk for breast cancer as well. So just make sure that they talk to their doctor about that and stay on top of that. Klinefelter syndrome is a rare genetic condition where a male has an extra X chromosome, which can lead to the body making higher levels of estrogen and lower levels of androgen. So if men know that they have that, that's something that you can talk to your doctor about, and I've linked to more information here about that. Any kind of testicular trauma, meaning an injury or swelling or any kind of surgery to remove the testicles, can increase a male breast cancer risk. Liver disease can lower androgen levels and raise estrogen levels in men, which increases the risk of breast cancer. And then obesity and being overweight also have a higher risk. And again, some of these are pretty similar to what we see in other kinds of cancers as well. So for prevention, we talk a lot about women doing their monthly self-breast exams, but it is just as important for men to be doing these as well. And on my next slide, I have a little bit of more information about that, and I'm going to be sharing a link that has some printable cards that we can hand out to the men in our lives, whether we are seeing them just casually or whether we're at a health fair or event where we're promoting different kinds of healthy lifestyles. That should absolutely be a part of the conversation, getting men to do their self-breast exam. We know that in general, healthy lifestyle, diet, exercise, abstaining from smoking and excessive drinking is of course going to be a way to prevent male breast cancer. It is with every cancer, right? Every speaker that we have on here mentions these things as risk factors for all different kinds of diseases, and male breast cancer is no different. And then it's really important for men to know their family history, right? Women are plugged into this screening routine of getting a mammogram every year and sort of really being aware of breast cancer, since it is so common in women. But because it's not as common in men, it's not talked about. Men aren't recommended for yearly mammograms. So it's something that men have to really be conscious of sort of on their own, because so much of what we talk about with breast cancer is focused on women because it's so common in women. So knowing if anyone in your family has a BRCA mutation and making sure that you go to a genetic counselor and get that tested yourself. We have great genetic counselors at the University of Chicago. You can make an appointment and they're able to give you the test, give you the results, give you some information about what the next steps are, what you need to do. So we do highly recommend them. And then just knowing if you have a first-degree relative with early onset breast cancer or ovarian cancer, that may mean when women get breast cancer at an early stage, or ovarian cancer not at an early stage, at an early age, meaning like before 50. And same thing with ovarian cancer. That means that they may be likely to have a BRCA1 or a BRCA2 mutation as well. So knowing your family history is going to really be helpful to know who should get tested for these genes and what it means for your individual cancer risk. So this is the self-breast exam for men. It looks a lot like a self-breast exam for women. So this is something that men should do every month, usually on the same day of every month. And it's, like I said, it's similar to women. It's checking your breast for any kind of abnormalities, examining the nipple and underneath the nipple, examining under their arms. And then just doing the pat in a circular motion around the breast to feel for any lumps or any kind of irregularities. Again, the signs and symptoms: painless lump, thickening of the breast skin, changes, any sort of changes to the skin covering the breast. If you know what your breasts are supposed to look like, and again, this is for men and women, even though we're talking about male breast cancer here. If you know what your breasts look like, it's easier to know if you're making those, those exams every month and getting really familiar with what your breasts are supposed to look like. It's much easier to spot changes to them. So any kind of changes to the skin, dimpling, wrinkling, redness, scaling, changes to the nipple, right? Discharge, redness, scaling, or turning inward. These are all signs and symptoms to be looking out for in men and women, but especially men for Men's Health Month today, to be looking out for. And that's something that you should talk to your doctor about. As I mentioned, doctors do not typically recommend mammograms for men. Men don't have a lot of breast tissue, so it's hard for mammograms to even pick up on lumps. But for men who have one of those genetic risk factors, please talk to your doctor. Usually they will come up with a screening routine that makes sense for you. They'll encourage the monthly self-breast exams. They'll do clinical exams with a physician in the office. They might recommend a mammogram or MRI depending on what they find and what your particular risk factor is. So this is something that we really need men to be open about with their doctor and just to be on top of, because again, this is just not something that that gets a lot of awareness in the way that other cancers do. So the Male Breast Cancer Coalition is an organization that has a bunch of resources for men with breast cancer. And they started a documentary short series called Men Have Breasts Too, basically just highlighting all of the survivor stories of men with breast cancer. And so I'm going to be highlighting one of them today. And we think that these are really, I'm actually going to link to this, this video series as well for all of you. We're doing some research in our office to really see how powerful the impact of survivor stories can be, because there is a little bit of research that shows that personal narratives and testimonies from cancer survivors can really be a great motivator for people to take their own health more seriously, to take their own screenings more seriously. And so we find we're in our office, we have a research project going that's trying to look at that a little bit more with colorectal cancer. And so we think that these male breast cancer videos can also be really powerful because, again, it's just not on the mind of many men. It's unlikely that you'll meet a lot of men in your life who have breast cancer the way we all tend to know someone who's had female breast cancer. So we think that these survivor stories are really important for getting the word out about male breast cancer awareness. So I'm going to play this survivor video. Let's see. Hopefully you all can see this and hear it once it starts. Erica, please let me know if for some reason it's not working.
Oh, hold on. It's working.
We very quickly became cancer deaf. That's all we heard at one point in time was the word. It was from my son. When you say you can get breast cancer, a guy can get breast cancer, and you show a now 30-year-old guy, it's like, wow, I didn't know. And that's been the problem. People don't know or believe. When Brett called, he told me that the doctor had called him and he said, I think you have cancer, but we'll know more in a couple of days when we get the rest of the pathology back. I was sitting literally at my desk. Peggy was next to me working on a video project. And he said, don't tell mom, because I don't know yet. Didn't work. So it's funny that emotion is not really emotion. It's just reliving a very scary moment. Don't tell Mom. Are you kidding? I hung up the phone and she knew immediately something was wrong. But we went to action. We started making phone calls, screaming and yelling, hooting and hollering to get ahead of it, to understand, try to figure it out. But it's no stone unturned. It's yours. It's your kid. It's your human. Peggy just went after it. No ifs, ands, or buts. We just decided we're going to be in charge. And of course, the first thing she did was call Brad. But breast cancer in a guy, men getting breast cancer, people, if they shake their head. Wait a minute, what? Really? Nobody really, everybody thinks it's a joke. It's not really a joke to them, but they thought it was kind of a spoof. And then they realized, oh, wait a minute, you're serious. I did not know. We didn't know. We found out the hard way. Crazy. What I remember about that particular morning was a cloud.
Well, it's 1T day for my wonderful son, Brett Miller. He's my hero. But he's got the biggest battle of his life today. The biggest one I've ever had in my lifetime. You are my hero. You are my rock. I love you more than you'll ever know.
We got him there early and to get checked in to get ready to have this mastectomy, which, wow, you know, that's amazing. It's horrible. It's scary. It's amazing that you can do it and you can have it done. Oh, wait a minute, that's my kid.
We're going to go ahead and do that surgery, okay? So you remember we talked about the options for breast cancer. And in you, I think the best option would be a mastectomy. So we can remove that whole tumor and get clear margins. And we're going to sample some lymph nodes as well, okay?
It was scary, yeah. It was scary. But it was kind of blur. It was a definite blur. I remember everything and forget everything. I got these pictures. I remember the moment in the room with his Dr. McCroskey talking about what he's going to do and why and what to expect. And we were kind of gathered around, and it was blah 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 blah. And it was really just a blur of words.
So that's where those sentinel nodes are. And
Okay.
remove a few sentinel nodes. If they look good on frozen section, then we won't need to take any more.
It was just, it's funny. I could literally remember every word. I can't pronounce every word. Because it was just a blur of nerves. It was scary, but I was very confident that it was going to come out good.
Oh, yeah. I'll be out to visit with you right away.
Thank you so much, Doc.
I'll see you soon. We're going to take good care of you. Okay.
I love you. Love you, son. And I hope you'll be all right. When the doctor came into the waiting room, there was a pretty good group of people in the waiting room, and we were just scared. So we heard that he was excited. He was happy. He was proud. We'd come in with such a powerful look on his face. It felt so good and so confident about what he saw and what he was able to do, and the clear margins and the no lymph node involvement. And you hear that from him without any question. Goes away. So the first time we saw Brett, We felt good. We felt confident or reassured. We still know that there was other things we had to worry about. And then to see the surgical site and the drain really is a reality check. He kind of shrugged his shoulders. He acknowledged it, that he felt good about it. He was done, and he was on his way. And McCroskey, as a doctor, Dr. Lon's his first name. What a human. And because of that, we felt good. And you gotta have confidence in somebody. You have to believe. You have to believe in what they're gonna do. Otherwise, you're just gonna second guess your own self. But we didn't. This guy is amazing. He spent the night, and of course they had to finish the drain and teach him what he had to do, and of course we had to get that education too. He couldn't really do everything by himself.
They're home.
The kids, in the way they reacted to him, they never quit giving him crap.
Maybe he's sore subject, but here's a test to nipples. But without them, the tits would be pointless.
I like it, Bobby. That's pretty good.
Oh, great! Thanks. Now I got to worry about it too. I mean, it was funny because we do make a lot of jokes. We do, and they get that from me. What are you laughing at? But without it, it's a lot more. It's a lot more sad when you're not happy. It's so important for everybody's family, and everybody's family will support. You can't not. It's in our DNA to concern, worry. And the kids in our family, Peggy in particular, there's no stopping her. The kids were always concerned if we were concerned. But they had their own lives. They had their own worries, but they always wanted to check in on what does Brett need or what can I do to help. The focus was on Brett because it happened. But I know that they were concerned. In the back of the head, you immediately think, oh my God, who's next? When's the other shoe going to drop? And that's the scary part. That's the unknown part. How do you get past that? Do you? Can you? Every day? No. Every day you got to kind of wonder, is this going to slip through the gene hole? And all of a sudden, now we got another problem. We got another scary day. So far, no. For a period of months while he was going through chemo, kind of afraid to talk about it because I feel guilty. Why you? He never said, why me? We said, why you? He was strong, quiet, outward, and not. But he checked in, got his treatments, came home, either took a nap or went right straight to work. We're lucky that it didn't affect him as adversely as it affects many that we know have gone through any kind of chemo or treatment or irradiation. Maybe he's lucky because he was so young. Just put his head down and went forward. That's the biggest challenge through this whole thing. We're back to the initial part of it is the what? You do? I didn't know you could do that. It is dealing with a fact that nobody else could believe could be a fact. Male breast cancer. Breast cancer, but male breast cancer just really boggles everybody's mind. And there was a certain amount of, don't think embarrassment is the word, but there's a little bit of intimidation involved with that he had to share, and he didn't for a little while. But after a while, he said, like he said, it became a badge of courage. It's a funny word, it's a funny phrase, but it became, well, I got to go forward. I got to get better, and I got to move on, but I got to be able to tell somebody else down the road it's possible. Brett's whole premise is, how do you not tell somebody else to pay attention to yourself without, as he said, making it all about me? But unfortunately, we're doing this because of him. So that adds the credence to the whole thing. That adds the power to the whole thing. Is you can't tell somebody, hey, you can get male breast cancer without proof. Don't mean to scare you, but guys, you can get breast cancer. Will you? No, probably not. But there's a possibility, so pay attention. Be aware of it. That's the catch. When you start seeing guys of all shapes and colors and sizes and locations and geography finally coming forward and given their history or their chronological story about what they went through and why, people coming forward, they're getting involved in their own geography. And so it's all these pieces of the map that come together to make this one little thing, this little male breast cancer coalition. It's pretty cool. Now we have guys from really all over the country, all over the world, who are finally saying, me too. When I thought I was by myself, I thought I was alone. And that's been the whole premise is, come out, tell us about it. And don't be ashamed. It's not your fault. You can gain some knowledge, you gain comfort more than anything else to feel confident, speak out. If you need a resource, we're always gaining to have a resource of help. We're not the doctors, but if we have a doctor's information or a story or a study, if we have it up there, read it. Will it apply to you? Can it help you? Before they wouldn't talk about it. Now they're going to events. They're going and participating. They're putting on the headband or the wristband, but they're still such a small cog, and they feel that way. Well, it's only 1%. We've only heard that from everybody we've ever talked to. When we hear that, quite frankly, we get a little rude. Yeah, it's only 1%. Would you like to be one of the 1%? Do you have a son, or you would mind being 1% because it's only 1%, right? How involved are we, or I, involved in raising awareness for breast cancer, male breast cancer in particular? Fortunately, only about 24 hours a day. But it's not something we can take away or remove, but the conviction to keep it up, to keep it going. It's funny, I don't even know where that is. When we say breast cancer, male breast cancer, and you want a proof source, here's a kid, here's a guy. How do I feel about him getting people to talk about breast cancer or their particular case, male breast cancer? Amazed, really proud, amazed. It's really a powerful thing, and I understand why so many guys that we have met in person and or online or whatever, why it's so powerful for them too. It's not in your normal speaking language, male breast cancer. It's just not.
My name is Brett Miller. I am 25 years old, and I am a 1-year male breast cancer survivor.
When he gets up to go speak or be part of a big group and be up on stage with somebody else, it's amazing. The 8 o'clock in the morning walks, which we just love a lot. Why don't anybody hold a walk at 2 o'clock in the afternoon? What you don't know about Brett is incredibly quiet, assured, self-assured, strong son of a gun. He is a doer, very quietly. He's the caretaker for all of us.
I'm actually going to go ahead and stop the video here just because I want to make sure that we don't go too far over time, and it gets a little repetitive there, but oops. Okay, so I think a couple of things that stand out to me from that video, and which is why I really liked it, is this idea of the embarrassment around male breast cancer and the shame that goes along with it. I can even tell you from personal experience that we have BRCA mutations in my family, and I have men who will not get tested because they're like, oh, don't be ridiculous. That's not going to happen to me. That's so, that doesn't happen. And so I think the point of really holding this webinar today was just to really raise more awareness that yes, it is rare, but men can and do get breast cancer. As we saw, this is a 25-year-old, otherwise healthy looking guy who got breast cancer. And so just making sure that we are sharing this information with all of the men in our lives, that this is a rare cancer, but it can absolutely happen to them. And the only way really to prevent it is to be checking themselves, knowing their family history, and having a healthy lifestyle, and talking with their doctor about it if they suspect that they have any of the signs or symptoms, and just being on top of their own health. So this is really an important discussion that we should all be having with the men in our lives. And I know I will, and I hope you all will too.